Coachella Valley, and welcome to Live with Your Chamber. I'm your host, Katie Stice, CEO at the amazing Rancho Mirage Chamber of Commerce. And we're truly excited today to introduce you to a brand new CEO who's come out here to the Valley to really run Vibra Rehabilitation Hospital of Rancho Mirage. If you haven't met the new CEO, Petre, well, you're just going to have to keep an eye out for him on the cover of the Rancho Mirage Insider. But definitely stay tuned to this interview. And if you're watching, let us know in the comments where you're watching from. We'd love to say hello. But without further ado, let's bring out our guests today. Patrick, welcome to the show.
Hi, Katie. Thanks for having interest in Vibra.
Absolutely. It's such a huge, important part of Rancho Mirage. And for anyone who is out there who's not familiar with Vibra Rehabilitation Hospital of Rancho Mirage, why don't you share a little bit about who you are?
Sure, Katie. At the corner of Duval and Ramon Road in Rancho Mirage, you'll see our 50-bed facility. We are an inpatient rehabilitation hospital. We are associated with Eisenhower Medical Center, who's in a joint partnership with another entity. Our patients are here for, when I say rehabilitation, these are patients who have had stroke, Parkinson's, orthopedic issues, knee replacements, etc., automobile accidents. And they're here for rehabilitation, which is centered around physical therapy, occupational therapy, and speech therapy. The average patient is here about 12 days. The majority of our patients are of Medicare age.
Okay.
And the majority of our patients come from Eisenhower Medical Center, although we're taking patients from private homes, other facilities all over Riverside County.
Wow. And we're thrilled that you're leading the helm. When did you start this position?
Well, I actually started in May of last year.
Okay.
My wife and I relocated to Palm Desert, which we love, in 2018. My wife is a nurse as well, not in this facility. And we're at that part of our life. The kids are older and gone, and we're still in healthcare. We both went through the COVID time, which was an interesting time to be in healthcare, but
yes,
we really like being here in the Coachella Valley. This is our, as I said, our fourth year, and Vibra, the facility there is a great resource for folks who need our type of services.
Absolutely. And you were talking about your career in healthcare. How did you begin your career in healthcare?
Well, I'm not the youngest CEO around, so I got into the CEO ranks differently. Most of the young folks that are coming in today come from programs, Masters of Health Administration, internships, etc. But back in the day when I got out of the military, I kind of fell into healthcare, and one of those people who back in the 80s could actually work your way up through the ranks, so to speak. And have run a couple of acute care hospitals in the LA basin.
Okay.
But when we moved out here, this was a great opportunity. Of course, anything associated with Eisenhower is first class.
Yep, absolutely. And yeah, we're thrilled to have you at the helm of such an important organization in the Valley for our residents here and visitors alike. Tell us a little bit more about what businesses can do to better understand, pay for, and administer healthcare for their employees.
Well, you know what? Healthcare, especially in the last 25 or 30 years, is really a hot topic, and putting the politics aside, it always revolves around cost. And whether you're talking about Obamacare or Medicare or private insurance, the issue with businesses in particular, since we're talking about the Chamber of Commerce, has always been how can I deal with and handle and respond to and manage the cost of healthcare? And I think if I'm running a business, I think the first thing I want to do is make sure that I'm doing my homework and my research when I'm purchasing healthcare plans for my employees. And there's a lot of products out on the market, everything from Kaiser in the
Mhm.
Valley. Kaiser has a big presence now, as you know,
Mhm.
in the Coachella Valley, to all kinds of different plans. And it's really incumbent upon the employer, I think, to have people on his staff who can translate and understand the crazy insurance and payer world so they can pick the best product, the most economical product for their employees.
Excellent. And as we're talking about the cost of healthcare, why is it so expensive, and what does the future in your eyes really look like as far as the cost of healthcare goes?
Well, I'll tell you, and again, this is a personal opinion for
Hmm.
somebody who's been around it for a long time.
Hmm.
Number one, we haven't reined in the cost,
Hmm.
despite the fact that we have tried everything, managed care, capitation, all types of strategies and tactics and whatnot. But what continues to drive the cost, from my perspective, are three areas. Number one is technology. We all want the best technology, and right now, Katie, it's not inexpensive to get it
Hmm.
and to buy it and to deploy it and train your people on it. Uh, Number two is the pharmaceuticals, and I think no one would argue, including those in the pharmaceutical industry, that as we become more sophisticated with our medications, the cost of those is also an issue, uh, and has yet to be really truly managed. So,
Hmm.
and the third thing is the labor force. You know, any hospital, including ours,
Hmm.
50% of your cost is your labor. And the costs now for in any business, and we all know what we're going through now in the post COVID world, but in particular for healthcare, uh, um, the cost of the clinical staff
Hmm.
continues to
Yep.
rise every year. So until we can get a handle on those three arenas, cost is going to be a concern. And we've looked to foreign countries who say they have a handle on it,
Hmm.
with socialized medicine and whatnot, but without belaboring it. When you dig down in the weeds, for example, the Canadian system, there are still a lot of cost involved with that. So I think as a society and as our regulatory folks and our governmental folks still have a ways to go.
Hmm.
But the best thing you can do as an individual or a business is get yourself educated.
And where would someone even begin? Where would you recommend folks begin when it comes to getting educated as far as how they can access or purchase healthcare? Where do you start?
Well, well, I tell you, believe it or not, the internet. And as
Okay.
much as those of us in healthcare, uh, the internet has made healthcare very transparent. I mean, when I started out, going to a hospital was a big secret. Nobody knew the doctors, nobody knew where you were, et cetera, et cetera. But the internet is full of great information on how to position yourself if you have to buy a plan for yourself.
Hmm.
If you're of Medicare age, how do you deploy Medicare for yourself?
Hmm.
Medi-Cal, Medicaid. Uh, uh, get on that internet, type in what you want to know, and get educated.
And lastly, what should folks know about being in a healthcare facility, either for themselves or for loved ones?
Yeah, it's interesting. It's a great question. I often tell people that hopefully you will never go to a hospital, but
Hmm.
for many of us, it's going to be a trip that we're going to make at one point in time or another, either by choice or not. And there's really a couple things that you should know before you go into a hospital, like how does a hospital work? And the first thing that I would advise people, that if you ever find yourself going to a hospital in an emergent or non-emergent situation, really have an advocate with you.
Yes.
Even at our hospital, we encourage people to visit and stay as many hours as they can. And that it's not a shot at those of us that are healthcare workers, but healthcare has become a very complex issue. And to
Hmm.
have someone there who's advocating for you,
Yep.
helping you to explain things, talking to physicians and nurses, I think is a real plus. The second thing I would do, depending on where you live geographically and what your insurances are, know who is your hospital?
Mm-hmm.
And try to get information. Go on the website and understand, hey, I live in Indio, and looks like if something ever happens to me or my family, it looks like I'm going to be going to JFK, quite frankly. So
Mm-hmm.
let's find out about JFK. Who's on the medical staff? Do I have a primary physician that goes there? So again, I think for years, as a guy who grew up in healthcare, for
Mm-hmm.
years, I think people have just taken it for granted that the healthcare system will take care of you. It will. However, you need to do your own homework and be prepared as well.
I love that. I think that's such great advice and information. And I know I said that was the last question, but I have one more for you. You know,
Sure.
I can really tell that this is your expertise and this is your passion, and you are really good at it, clearly. Why do you do what you do?
Well, it's interesting. We had this morning we had about 25 first-year nursing students from College of the Desert, which is in Palm Desert, who do some of their training here. And uh, a point that I made to them, for a guy like me, I grew up, I am a non-clinician. I am not a nurse, a respiratory
Hmm.
therapist, which is not unusual in our business to have a non-clinical male or female running a whole staff of clinicians. So for
Hmm.
me, it's just a great reward to be associated and work with these people. Are well trained, they're brilliant, they're smart, they're compassionate, all the things you want when you walk in the door of any hospital. And for me to watch these folks in action, at the end of the day, most of the time, the patient is walking out of your facility, be it our facility, Eisenhower, Desert, it doesn't matter, and have had a positive experience,
Yeah.
and their health has improved, and that's a great reward.
Well, I love that. That's really shows, it tells a lot about who you are and why you do what you do. So I appreciate that. And for those of you who are out there watching and haven't had the pleasure of meeting Patrick yet, we do have a mixer coming up with the Chamber of Commerce at Vibra. So down below in the comments, we'll make sure that we put that information, and we'll also have it on our website as well. But Patrick, I just want to say thank you so much for your time today. Really appreciate getting to know you, and I know you're a big part of this community now. So, if there's ever any way that we can help get you connected, please don't hesitate to let us know.
Okay, thank you, really enjoyed it.
All right, we'll be in touch soon, my friend. Take care.
Bye.
And thank you so much for joining us today. Again, their website is right on the screen. Please make sure to check it out, learn a little bit more about who they are and what they do. It's a really big piece, an important part of not just Rancho Mirage, but our valley as well. I want to take a minute to thank our sponsors, News Channel 3 and CBS Local 2 as well. If there's ever a way that I can help support your business, your nonprofit organization, or you professionally, please don't hesitate to reach out. That's what your Chamber of Commerce is here for. We'll look forward to seeing you all soon. Take care of yourselves and each other. Bye.